I'm Marie Yamada, Dr. Yamada, who's a member of the faculty at USC School of Social Work, interested in culturally appropriate assessment and disparities in mental health delivery systems. We have Karen Kyeung Lee, an LCSW, who's a doctoral candidate at USC School of Social Work, and Hannah Nguyen, an MSW from UCLA, who is the Vietnamese coordinator for racial ethnic approaches to community health. So please welcome them all.
Hi, thank you all for coming. You know, it's tough to stay awake this late in the day, so we appreciate it. And I mean, actually, one of our presenters to, or the okay. I just want to give you a quick little orientation. So you have a little map of what's going to happen today before we get going. So what we're going to do now is a little brainstorming activity, get all the juice flowing. Everyone should have note cards. If you didn't get note cards, raise your hand and Hannah will bring you some note cards. Hannah, can you see everybody? Okay, sure gets to you then. And then we're going to do an overview of the problem that we're struggling with our research, which is disparities or lack of care for mental health needs among Asian Americans. And we're going to talk a little bit about our studies, some of the literature, and we're going to leave plenty of time to do some small group discussion with you so that we can engage you and also hear what you think and get your input. That's a really neat thing we can do with a really mixed group today, so we want to take advantage of that. And then we'll come back and wrap up with the big group again after our discussion. Okay, so as soon as Hannah's ready, we'll do that. In the meantime, I can just tell you a little bit about what we are doing. So we've been doing research for the last 3 or 4 years, it feels like longer, on different Asian American communities in the Southern California region to look at attitudes towards mental health among clergy and spiritual leaders that work in the Asian American communities. We're really looking at trying to develop an intervention to increase access to mental health care for people that really need it. And so we've been primarily looking at the clergy. And so when we talk today, we just want to keep that in mind that we haven't yet done all of our interviews with mental health providers. So our perspective is a little biased at this point from one side, from the faith leader side. And also that we're really primarily in our exploratory work talking and working a lot with first generation immigrant issues. So there's a lot of generation differences in the Asian American community. And so most of what we say fits best with the immigrant communities. And then primarily our work has been in Korean, Vietnamese, and Chinese communities. We've been expanding as we have new researchers join our team. We're planning to do India, Hindu group in the fall, and a Filipino group also next year. We've been looking primarily at Christian communities, and we've started expanding now to Buddhist communities as well, with the Vietnamese and the Chinese communities. So primarily, that's what we're here to talk about, the challenge in overcoming stigma towards mental illness. And are the churches a good resource for that? Initially, when we started our work, we thought, of course, this is the way to go. Now we're a little more skeptical. We have a lot of data, and it's really showing us how complex the issues are. So that's another nice thing that we can get some great feedback today on what we're learning. So. Okay, I'm going to turn things over to Hannah now for our little activity.
Okay,
Okay, so I would ask that you take out the cards that I just gave to you. I think the yellow cards, and some of you might have green. This is just a quick activity for us to brainstorm or think about some of the issues that we're going to talk about today that relates to the topic of collaboration between clergy and service providers to improve mental health services for the communities and family members. And so what I am going to do is I will mention 3 things, 3 ideas, and what I'll do is give you 30 seconds to brainstorm, write down anything that you can think of, that anything that comes to mind when I mention these words to you. So is everyone all set? Do we all have the cards and the pen? Yes. Okay. Okay, so the first word is, what comes to your mind when you think of severe mental illness? 30 seconds. Anything that comes to your mind. Severe mental illness. Oh, you're writing it down on the card. This is a brainstorm activity, as we usually do in school, right? Any words, it could be from 1 to 10 to 15 to 20. I encourage you to do at most as you can, because I think this activity will bring out certain values or ideas or conceptions that you have about severe mental illness, and so we want to do this really quickly. We're going to move on to the next word. What comes to your mind when you think about the Christian Church's views of mental illness? Or illness in general? You can do it on the other side of the card if you would like, for the different words. Okay, and the last word we're going to think about is, what comes to mind when you hear the word mental health services? Mental health services. Okay, so that wraps up our quick brainstorm activities, and I'll ask that you keep these words and these ideas in mind as we go along the today's sessions and the small group discussions. Thank you. May I ask the monitor to help us collect the cards?
If you wouldn't mind, there's a little sticker that asks for some basic information. If you wouldn't mind filling that out, it'll sort of help us to get an idea. And we're researchers at heart. We have trouble avoiding opportunities to look at differences in opinions. So if you don't mind, if you would jot that down for us, that would be great. Just in general, if you MSW or 10 years or just a basic idea. Yes, I have that training. Okay, while she's collecting those, let me go ahead and go over some of the background for you.
There they are. They are kind of reddish.
No problem. All right, so then I'm going to give you just a little bit more background today before we dive into our ethnic-specific communities in general. One of the reasons why we're interested in working with Asian Americans and with our research project is that although some of the recent epidemiology studies have shown that Asian Americans have lower rates of mental illness than their white counterparts in the U.S., still they have the lowest rate of use of mental health services. So over the past 10 years, there's been an increase in service use among African Americans and Latino populations that hasn't been seen in the Asian American community, and primarily, especially in the immigrant first generation, which is where most of our research, as I said, is concerned. So as the number of Asian immigrants increases and the need for mental health services increases just numerically, we're really interested in looking at the community and what kind of resources there might be to help meet these needs outside of traditional formal mental health services. So some of the reasons why we want to do that are because there are a lot of barriers for mental health service use. Anything from lack of diagnosis to lack of awareness of what services there are to a lack of services that are available to provide these services. And among all of these things, one of the things that has stood out for us has been stigma. That stigma has been something that has been in all of our studies that we find over and over again. So for us, when we talk about stigma, we're really interested in the social part of stigma, or public stigma. So this is really the reaction that people have in response to someone with mental illness. So just as we ask you to react to severe mental illness, that's very different as a concept than it is when you're interacting with a person in the community. But nonetheless, there's a lot of different opinions and attitudes out there that feed into the prejudice, discrimination, and stereotypes that we all have about mental illness. And so this is something that has a lot of negative consequences for people, and Asian Americans in particular, because of the social nature of the culture and the impact of not only for themselves, but on their whole family. So that makes it something that we really want to see what we can do to intervene with. So we're really looking at the churches, not schools. There. Okay. I think I'll stick with that. That way I can flip my notes at the same class if that works. That's the advantage of having a stand here. See, his name is Stan. Oh, he hold his tree. Okay. His name is Stan, and he's a good stand, Leslie. Cool. Yay. Human accessibility is my favorite kind. Way over technology. So, as I was saying, we're really looking at the church communities, not so much because we think all Asian Americans are walking around with Bibles and are extremely religious, and this is the way to go. We're really looking at it as a comprehensive, multidimensional, multifaceted service center that a lot of churches are these days. So it's not only can you get prayer and faith, but in addition to that, there are a number of services. Everything from social support, financial support, language classes, English language classes, and really a whole lot of social activities and political activities that go on. So really we're looking at it as, can mental health fit in with all of these other services? What does it look like now as it's currently happening? And what room is there for expansion? And so we really been looking in terms of clergy then and how they feel about mental illness and what they would share with us about what's going on in their churches. So I want to talk to you now a little bit about some of the specific communities that we're working in. And so I'm going to talk a little bit briefly, because you can see here, about our Christian Chinese community and what we're doing with that part of our data. So in general, there are about 700 Chinese churches listed in directories in the United States. And that doesn't seem like a lot compared to other groups, but